In today's episode, we are going to dive deep into the hot weight loss topic of insulin resistance with my medical director, Dr. Mildred Santarufo. She is known to her patients as Dr. Millie. Dr. Millie has been the medical director for Real Results since 2018, and together we have helped over 1,000 people and counting reach their real weight loss results. Are you struggling with weight loss despite trying everything? You're not alone. Welcome to the Real Results for Life podcast, where we dive deep into the secrets of sustainable weight loss. I'm your host, Jamie Young, founder of Real Results Medical Weight Loss, located in Kennesaw, Georgia. With over 10 years in the medical weight loss industry, I've successfully guided hundreds of clients to their dream weights. In this podcast, we will explore the keys to sustainable weight loss and make healthy choices an important part of your lifestyle. At Real Results, we offer comprehensive solutions from online programs and medical appetite suppressants to personalized one-on-one coaching. Join me on this transformative journey to discover and embrace the best version of yourself, ensuring you look and feel great both from the inside out. Together, let's achieve lasting results, starting today and continuing for life. Before we get started, please remember that the information we share here is for educational purposes and from personal experience. Each individual's health, fitness, and nutrition needs are unique. Therefore, please consult a healthcare provider before making any changes to your diet or exercise routine. Let's learn together responsibly and make informed decisions about our health. Enjoy the show. In this episode, you are going to get all of your insulin resistance questions answered. And at the end of our conversation, Dr. Millie is going to share some red flags that could be an indication that you're struggling with insulin resistance and that it's time to connect with your primary care physician or find a weight loss program like Real Results who can help. And as a bonus in today's episode, I'm going to be sharing with you my favorite Southern calorie saving tip that I share with all of my clients in the Jamie's Gems section of the show. So without further ado, hi, Dr. Millie. Welcome to the show. I am so thrilled that you are here, and we're going to dive into a very hot topic, insulin resistance.
Thank you for having me. Yes, it is a major topic right now.
It is. And I like to start by just kind of going back in time a little bit. When we first started working together, there were two main weight loss options at that point. There was phentermine, which is an appetite suppressant that not everyone can take because they're not healthy enough for it. And then there was HCG, is a rapid weight loss program. And so those were the two options at that point. And we had lots of patients who would do both. They'll do different rounds of HCG. They do the diet, they do the exercise, and they're doing everything right, but not getting anywhere. And now that this insulin resistance topic has come to the surface and now has not only attention, but treatment options, it's been very cool to watch. People treat that insulin resistance with something like the semaglutides, the Ozempics, the Mounjaros, the tirzepatide, and watching the weight fall off finally. And it's just been amazing. So I wanted to ask you that even though insulin resistance is a hot topic right now, it's not new. So for those who have only heard the term insulin resistance, can you dive into what that is?
So first you have to know what insulin is. So insulin is the protein that carries the sugar from the blood into the cells to be used as energy. So when you eat, the food goes to your stomach, it breaks down, the sugar gets absorbed into your bloodstream. The bloodstream is the highway and the insulin is the exit ramps. Now, if those exit ramps have potholes or gaps, the sugar can't exit. So it starts to build up in your bloodstream. You start to become hyperglycemic and eventually pre-diabetic and diabetic. Well, your pancreas sees this happening and it freaks out. So it squeezes out more insulin. It puts more exit ramps on the highway, which works great. But then the cells can only use so much of that sugar. And what happens with all the extra sugar? It gets stored as fat. So the higher your insulin, the more weight, and the more. These medications fix that insulin resistance. So now your pancreas can start making less, and as that level drops, your weight drops.
I love that explanation. That made it makes so much sense. So insulin resistance does not mean diabetic. Can you define the difference between those terms for us?
So insulin resistance is what is the fundamental pathology that eventually causes diabetes, or at least type 2 diabetes. Type 1 diabetes, those individuals don't make insulin at all. That's a different situation. But what causes type 2 diabetes is when over time your insulin is becoming more defective and your body isn't paying attention to it. And so your pancreas is having to make more and more and more to get the same amount of work done as a lower level used to get accomplished. And there's a point where eventually you can't keep up with it, and then the sugar levels rise and become pre-diabetic and diabetic.
Right. Are there any other symptoms that would point you towards getting tested for insulin resistance if someone's listening and they just don't even know? Are there any symptoms in their life that they might notice?
So a lot of the symptoms of insulin resistance are also the symptoms of hyperglycemia and ultimately diabetes. So you may notice that you have more thirst or increased urination, numbness and tingling, blurred vision. You might notice having dark skin in your creases. You may notice more skin tag development. Those are all indicators of insulin resistance, which then causes metabolic syndrome and affects the blood, eventually goes into diabetes and usually elevated triglycerides and eventually heart disease. So it's just one step on the path into that direction.
And the best way to find out if this is something that you struggle with is to get labs done. I've seen just the story that I talked about earlier, patients doing everything right. I mean, they are eating great, they are exercising, they're hydrated, they're lowering their alcohol intake, they're just doing so many things right. And then they come and they're like, Jamie, I don't know what to do. And so I encourage them to do some labs, and we find out, oh wow, yep, you have insulin resistance, which is why you've been struggling. So once the labs are done, and is that an easy diagnosis? Once you have the labs, is that pretty straightforward?
If you're doing the right labs, because there unfortunately are still probably some physicians that rely upon just blood sugar. And if that's all that you're doing, you're going to miss a lot of folks until they're already fully blown diabetic. And that's exactly back in the day before we had some of these other labs, that was the case. We knew that by the time we diagnosed somebody with diabetes, they'd already been diabetic for 5 or 10 years because the fasting blood sugar is the last thing to go to become abnormal. Prior to that, your 2 hour postprandial, after eating, blood sugars were probably already going up. And so when the hemoglobin A1C came out, we started getting a little ahead and starting to catch people earlier. Well, now, if we were checking insulin levels on everyone, we could be catching people when their insulin levels are starting to go up and treat them at that point before it even started affecting their blood sugar levels. Unfortunately, insurance doesn't want to pay for insulin levels, so that's a limitation. Also, the reference ranges, once again, that are utilized for insulin are not very accurate. They say that a normal insulin, fasting insulin, goes up to 25, and that's not accurate at all. I have a lot of patients who are pre-diabetic whose insulin levels are lower than 25. And by definition, if you're pre-diabetic, you've already got insulin resistance. Not to mention that there are two formulas that we use to calculate insulin resistance, and they plug in the fasting insulin and the fasting glucose. And I can't tell you how many of the folks that come to see us that when I plug their numbers in, they have high insulin resistance, yet according to the lab, their insulin level's normal. So it's a combination of factors as to why people aren't getting diagnosed sooner. But if you're looking and if you're using the right information, we should be able to catch this quicker and fix it before it goes all the way to the other extreme and you start developing all the side effects and issues that go with diabetes.
Yeah, I love that. And catching things early is just huge and that's just across the board medically. So you diagnose these patients. So what's the next step? What are the big ways we can treat insulin resistance?
So there are some specific medications that is their mechanism of action. Certainly the GLP-1 agonist is the big class right now that everybody's talking about that does it, and they're certainly the strongest of everything. Prior to that, there was metformin, and metformin still does reverse insulin resistance and can be utilized. And if someone doesn't maybe have as much weight to lose or doesn't have quite that same level of insulin resistance, that's an appropriate place to start. You can certainly start there. But now there are more and more medications coming out that are specifically addressing that issue, and they do it by different mechanisms of action. The GLP-1s do it through the pancreas, whereas metformin does it through the liver. But they all kind of get you to the same place.
Yes, and I've seen this in patients is once the insulin resistance is treated, it really is incredible to watch their results. I mean, I've said it a lot because it really is incredible.
Mm-hmm.
So how does reversing the insulin resistance make such an impact in the weight loss journey?
Well, it's a fundamental. It fundamentally affects the metabolism. So it just allows the metabolism to speed up. It allows you to process the glucose and not store as much fat. You're not working sort of as slowly as you were before. It speeds everything up so that you're actually able to break down and utilize the glucose for energy and not store it.
Yeah. So the treatment options, we've got the metformin, we've got the GLP-1s. And so I actually get this question all the time from patients. They ask me, they get to their goal weight and they say, okay, well now what do I do? Once I get to my goal weight, do I stop taking the medication, or if I stop taking it, am I going to gain all my weight back? And I'll answer this question on the weight loss side of things. But after that, I would love to hear your viewpoint from the clinical side. I tell people that who lose weight. So a patient comes in, you fix their insulin resistance. They might use a GLP-1 medication and they lose 50 pounds. And we've been monitoring them, monitoring their labs every 16 weeks or so. And so then we get to the end, and I tell people, if you go back to the lifestyle that got you to an undesired weight to start with, eating fast food, not drinking enough water, not exercising, like if you go back to those things, it doesn't matter what the therapy you used to lose weight. Like if you go back to those activities, you're going to gain your weight back no matter what kind of medication it was. And so I really emphasize that with patients. And so, however, some people actually do need to stay on, they have insulin resistance. They need to treat it more long term. So outside of the changing your lifestyle, which I just kind of addressed, what type of therapies can help patients maintain their goal weight once they've reached it? Should they stay on these medications long term? What are your thoughts there?
So, it depends on the individual. But certainly if someone already comes to us and they're already pre-diabetic or diabetic, they probably will, it'll serve them well to remain on the medication. They may not have to stay on the highest dosage, but they probably are going to need to stay on a lower dosage to maintain, because they've already kind of crossed that tipping point, and they're more likely, their insulin resistance is more likely to come back much more easily, even if we've reversed it all the way. So if we want to keep it in check, the best way to do that is just kind of keep them on a low level of the medication to maintain it. If someone just had some pretty significant insulin resistance, but not all the way to being pre-diabetic or diabetic, or if someone has PCOS, they may do well to transition onto the metformin and utilize that to maintain them and to keep the insulin resistance from creeping back up again.
And we find that too. And the other thing I tell patients is, just because you reach your goal weight, you really need to maintain that weight for a year for it to really settle in.
Mm-hmm.
And so getting labs done every 16 weeks is just huge as far as preventing regaining weight,
Mm-hmm.
right? So I know we do those labs, and we're just making sure, one, that the insulin resistance reversed, but that we're staying healthy as we do it, because there are some negative side effects of some of the GLP-1s. Can you dive into those for us?
So the main side effects that occur with it, are what often folks think is the main way that the drug works, and that is that it decreases GI motility. It causes something called gastroparesis. And essentially, what that means is when you eat and food gets to your stomach, it sits there and it sits there. And what may have taken 2 hours to digest now takes four, or what may have taken four takes eight. And so, literally, the food's not moving on, it's staying there. And so, you're full. You're literally still full. The food is still sitting there. So then you don't have an appetite, which, okay, yeah, that's true. But if you're continuing to digest that over and over again, that's eventually going to make you feel pretty yucky and nauseated. And it also affects downstream, as it were, and you wind up with constipation as well. Now, in those individuals that don't have sufficient insulin resistance and are put on these medications, if they've already got a pretty low insulin level and they're going on it thinking they're going to be able to lose that last 5 pounds or what have you, it may actually push them into pancreatitis. So you're going to wind up turning your pancreas off. So there's that issue as well. And then there are some other, there's some reasons why someone couldn't be on the medication. One in particular is there's a specific type of thyroid cancer that it's been shown that the GLPs could potentially exacerbate or cause to manifest. And so anyone with a family history of that particular cancer or a previous history themselves of that type of cancer, they shouldn't be on a GLP. Also, you can't use it in pregnancy, and you have to be off of it for at least a couple of months before you try to get pregnant, so as to make sure it's completely out of your system. The other issue as well is if you need to have any surgical procedures, you have to make sure that it's out of your system for at least a week, 2 weeks, even better, because of that decrease in GI motility. We don't want you to aspirate during surgery and wind up with an aspiration pneumonia. So those are the issues that can occur with the medication.
Man, you just hit that all on the head. I mean, that was all amazing. And I think that's a lot of reason that people, all the negative media that it's getting, a lot of people don't know those things.
Mm-hmm.
And there's a lot of prescribers out there prescribing it without the proper lab work. And there's also different fake versions of it out there
Mm-hmm.
that people are selling. It's
Mm-hmm.
really, really scary. But
Mm-hmm.
a lot of the people that end up in the hospital or have a negative event with it, it's because they had no business being on it in the first place. So that's one thing that I'm very proud that we are very on top of.
Mm-hmm.
Our patients don't get sick on it because we're monitoring them and we're
Mm-hmm.
coaching them through the process. And I feel I'm a little scared for those patients out there who aren't getting that guidance and who
Mm-hmm.
aren't being monitored, because it really can be, yeah, that's where that all the negative stuff is
Mm-hmm.
stemming from. Well, we have really scratched the surface of insulin resistance overall. Is there anything that you would add to someone listening who may think that this is something that they're struggling with?
So again, unfortunately, it's one of those things where your doctor may not be able to do the insulin testing because of insurance restrictions. So you might have to utilize a different pathway to get the result, the labs done to see if this is what you have. I'd also caution that, the FDA, when they approved these medications for weight loss, they didn't actually say we had to do any blood work. When you're using it for diabetes, we do all sorts of blood work on these folks. But for weight loss, as long as your BMI is over a certain point or you have certain comorbidities, they said that you could be on it. And I think that there needs to be a little more follow-up and regulation with it. And that's why we are, like we said before, having the issues with some folks having those issues. There should be some baseline things that are being done prior to starting the medications.
Absolutely, and that's why finding a place like Real Results, if you if you're local to Kennesaw, that's where we are, right out north of Atlanta. But if you are not local, finding the right provider and the right support behind it, I agree, is absolutely key, because you can get amazing results and maintain those results long term if you're doing everything correctly. And then once you get to your goal weight, maintaining that. So I hope that this conversation was really beneficial for people who are really doing, like we said, everything right, but not getting the results that they're looking for. So thank you so much for diving into this with me, Dr. Millie, and I'm looking forward to future episodes.
My pleasure. Thank you for having me.
My friend, I hope you are enjoying this episode so far. And I know that weight loss can be overwhelming, and sometimes you don't even know where to start. Well, I have a quiz for you to help you get over that first step. So it's called Which Weight Loss Prescriptions Are Right for You? And it's going to ask you questions on your medical history and your lifestyle. And the resource can be found on my website at realresultsforlife.com, and click on the appetite suppressant section. By doing this quiz, it can point you in that right direction. And sometimes you just have to take that first step to get your real results. It is time for Jamie's Gems, a segment of the show where I give you a tip that you can implement right away in your health and wellness journey. So, the office is located in Kennesaw, Georgia, which is a suburb of Atlanta. And so we're in the South. And if you know anything about the South, Southerners like their sweet tea. Sweet tea has just been a part of the Southern culture, and sweet tea can have a ton of sugar. So when I meet with a new patient, I ask them, do you drink water? Tell me, do you drink soda? Do you drink sweet tea? And if they are drinking sweet tea, that's got to change in order to lower the calories and overall lower the sugar. But people like their sweet tea. So I want to give you a couple of tricks on how to transition to unsweet tea or use some artificial sweeteners. So let me kind of give you my first little tip here. Start slow when transitioning away from that high calorie, high sugar sweet tea beverage. First thing is make sure that if you're at a restaurant, that the waiter or waitress does not refill your sweet tea. Okay. One sweet tea is more than you need from a sugar perspective. So definitely make sure that you control your serving size of the sweet tea. Another trick at restaurants to use is you can actually order half sweet, half unsweet, and that can cut your sugar in half. I highly recommend doing that. But better yet, if you ask for unsweetened tea and bring your stevia or your Splenda and sweeten it yourself, that is going to be the winning option. So people ask me a lot what my favorite calorie sweetener is, and stevia versus equal versus the blue, the pink, the yellow, the green. And so from a health perspective, stevia, which is that green one, is going to be the healthier version. So stevia is actually an herb that just happens to be sweet, and companies will make it into a powder. So that one, from a health perspective, stevia is going to be your best option to sweeten. And my personal favorite from a flavor perspective is Splenda. So if you're making your tea at home, one thing that I recommend is to get Splenda and make your sweet tea with Splenda. Just give it a try. And again, tip number one was just go slow with this transition. You can if you normally make a batch of sweet tea and 2 cups of sugar normally, you could do 1 cup of regular sugar and 1 cup of Splenda. And again, you're slicing your sugar intake in half. So it's a great place to start. And then each time you make it, you can actually do lower it again. So half a cup and then 1/4 of a cup, and replacing it overall with Splenda, which is a artificial sweetener. And again, some people are on the side of the fence that artificial sugars are bad, and it's kind of like, which fight do you want to fight in that department? Do you want to do sugar and mess up your insulin resistance that we talked with Dr. Millie about today, or, really throwing off your weight loss journey by having so much sugar, or the potential side effects of artificial sweeteners where you can lose weight, which again, you're going to have benefits of losing weight with that. So, however, stevia or Splenda are the ones that I recommend. And I hope that this can sweeten up your sweet tea and help you get your real weight loss results. Thank you for tuning in to the Real Results for Life podcast. Your dedication to self-improvement is truly inspiring. If you're serious about achieving your goals, make sure that you hit that subscribe button. By subscribing to this podcast, it will provide you with ongoing encouragement and support, filling your cup with valuable tips and motivation to help you succeed.
At Real Results, we're excited to offer you several online weight loss solutions that cater specifically to your goals. One program I'm thrilled to highlight today is our semaglutide at-home program. It's specifically designed to kickstart your weight loss journey and support you every step along the way, right from the comfort of your own home. Our program begins with the semaglutide online launch package, which will give you immediate access to our comprehensive online coaching program. This includes training videos, dietary guides, hundreds of recipes, and more. The package covers the cost of your initial lab work and a virtual appointment with our medical director. Once approved for the medication, your semaglutide will be automatically billed, shipped, and delivered directly to your door. Achieving your health goals has never been more straightforward or convenient. Are you ready to transform your life like hundreds of my other clients? Click the link in the show notes or go to realresultsforlife.com to learn more and join our semaglutide at home program today. Thank you again for listening. Remember, with dedication and the right support, real results are within reach.